This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, a senior attending here, and today we are diving back into the evolving landscape of minimally invasive spine surgery.
And I'm Dr. Alara, a research fellow. Today we're looking at a fascinating new study from the journal Neurology India, published in 2026. It's a comprehensive meta-analysis titled Uniportal Endoscopic versus Microscopic Unilateral Laminotomy for Bilateral Decompression in the Treatment of Lumbar Spinal Stenosis.
This is a timely topic, Alara. For our residents and colleagues listening, we know that lumbar spinal stenosis, or LSS, is one of the most common reasons for spinal surgery in the elderly. The gold standard has been shifting toward more tissue-sparing techniques. Specifically, we're talking about ULBD, Unilateral Laminotomy for Bilateral Decompression.
Exactly. The core of the debate highlighted in this paper is whether the uniportal endoscopic approach actually offers a significant advantage over the traditional microscopic approach. While both aim for that over-the-top decompression to relieve the contralateral side while preserving midline structures, the delivery system is quite different.
Right. And as the abstract mentions, the effectiveness of these two remains a subject of ongoing debate. Let's look at the meta-analysis findings. When we look at surgical parameters, what did the data show regarding operative time?
That's a key point for the surgical team. The meta-analysis suggests that the microscopic ULBD generally maintains a shorter operative time compared to the uniportal endoscopic approach. This is often attributed to the steep learning curve and the technical demands of working through a single endoscopic portal.
That makes sense from a clinical perspective. However, we have to weigh that operative time against the physiological cost to the patient. What did the paper find regarding blood loss and hospital stay?
This is where the uniportal endoscopic approach begins to shine. The study indicates that the endoscopic group experienced significantly less intraoperative blood loss. Furthermore, the length of hospital stay was shorter for patients undergoing the uniportal endoscopic procedure compared to the microscopic group. For a busy neurosurgery service, that's a significant factor in bed turnover and patient satisfaction.
It's that trade-off we often see, more time in the OR for a potentially faster recovery. But at the end of the day, our residents want to know about the clinical outcomes. Did the patients actually feel better? Did the meta-analysis look at the Visual Analog Scale, VAS, or the Oswestry Disability Index, ODI?
It did. The researchers looked closely at the clinical effectiveness using those exact metrics. Interestingly, the meta-analysis found that both uniportal endoscopic and microscopic ULBD are highly effective in managing LSS. When comparing post-operative VAS scores for back pain and leg pain, as well as the ODI scores, there was no statistically significant difference between the two groups in long-term follow-up.
So the effective part of the abstract holds true for both. Whether you use the microscope or the endoscope, the bilateral decompression part of the ULBD is being achieved successfully. If the clinical outcomes are similar, we have to look at the safety profile. What did the study say about complications?
The complication rates, such as dural tears or postoperative hematomas, were a major focus. The meta-analysis suggests that both techniques are comparable in terms of safety. While the uniportal approach is more minimally invasive, the microscopic approach provides that familiar three-dimensional visualization that many surgeons rely on to avoid complications. The paper notes that the choice often comes down to the surgeon's expertise and the specific pathology of the patient.
That's an important takeaway for our residents. You need to be proficient in the microscopic approach as your foundation, but the data here suggests that moving toward uniportal endoscopy could offer benefits in terms of reduced surgical trauma, less blood loss, and faster discharge, without sacrificing the quality of the decompression.
Precisely. The paper concludes that while both methods are excellent for treating lumbar spinal stenosis, the uniportal endoscopic ULBD is a viable and perhaps superior alternative when considering perioperative recovery metrics, even if it takes a bit longer in the operating room.
It's a fascinating look at where we are headed in 2026. For those of you in the clinic or the OR, keep an eye on these meta-analyses. They provide the high-level evidence we need to refine our surgical decision-making.
Definitely. Thank you for joining us on the Neurosurgery Hub podcast. We'll see you in the next episode.
Safe surgeries, everyone.